Good day, everyone! Now that we have come to the last day of Project Pro-CARI's webinar series, the proponent's final discussion is highly relevant and very timely. We are experiencing a global health crisis, and for us to be more aware of the harm that COVID-19 brings, the theme of the last webinar is Staying Well Together, Defending Ourselves from COVID-19. And to formally start, our webinar will be presented by a longtime advocate for caregivers in the areas of policy, health and social system development, research, and public awareness. Without any further delay, I am now handing it over to Family Caregiver Alliance, together with Ana Chadas, Doctor of Medicine, Master of Philosophy in Public Health, and Ria Mercado, a registered nurse and Masters of Science in Nursing.
Great, thank you so much. So this is Anna. I'll be speaking first and getting us started. Just really want to thank everybody for joining today. Just also acknowledge the challenging time that we're all going through, and just really grateful for your presence and the opportunity to be able to speak with you today on this topic. Hopefully it's helpful. Next slide, please. Do I have the power to advance it?
I'll be advancing from my end.
Thank you so much. So today we'll be going over briefly, I think it's been really helpful to just ground ourselves in what this is, what's going on, what this virus is, and how it's causing folks to be sick. And then of course we'll focus most of our time on how we prevent the spread of this illness called COVID-19. That really entails the hallmark method that we're all experiencing right now, which is the physical distancing method, often called social distancing, from a lot of the materials you might see from our departments of public health or the CDC. But really it's social because it's more than one person, but it's really about physical distancing from other people. Other strategies for preventing the spread are really the isolation of infected people and then disinfection of areas that may have gotten contaminated with virus. So we're going to go over all of those in depth. Next slide, please. So what is COVID-19? You may have seen in the news more than one explanation of what this is. Is it coronavirus? Is it COVID-19? I just want to add a little clarity so we're all talking about the same thing. So the pandemic is being caused by a virus. It's called, in the big grouping of viruses, a coronavirus. So there are many coronaviruses, and this very specific virus has a name, and the name is SARS-CoV-2. So the virus that we're dealing with is SARS-CoV-2, which is a type of coronavirus, and it's related to the viruses that caused the SARS outbreak and the MERS outbreak, neither of which got past their regions in Asia and infected many people here. But certainly they took a big toll where they had outbreaks in other parts of the world. But here, obviously, this virus has reached us. And when people say COVID or COVID-19, they're talking about the clinical syndrome or the clinical presentation and illness that is caused by the virus. So COVID-19 is the illness caused by SARS-CoV-2. And truthfully, we're learning more about both of those, both the virus and how it behaves, how it infects us, how long it stays around, things like that. We're learning more about that every single day. And we're also learning more about the clinical illness of COVID. What happens to people? What are symptoms of this illness? Next slide, please. I think, though, we do know some of the main symptoms that are common, particularly for people who get pretty sick with this virus. So the main symptoms of COVID-19 are fever, shortness of breath, and cough. However, many people report other symptoms, often sort of like a flu symptom, which is why many places will test for coronavirus and test for flu at the same time. So people say they're really achy, very sore muscles. Some people have said they have a sore throat, particularly as they start to get sick. Same thing with diarrhea, that can be early on when they get sick with this virus. They get tired. And a really interesting one is a lot of people have reported losing their sense of smell or their sense of taste, or both. The other thing we know about this illness is that it can be extremely mild or extremely severe. And there's not a perfect way to predict who gets mild illness or severe illness. And unfortunately, as we all also know, people can be so severely ill that they die from the illness. So it looks like the information that we have from all of the global infections so far is that roughly 80% of people who get sick with the virus will get a mild illness. So many have no symptoms. Sometimes that's called asymptomatic, but no symptoms. So that means they have the virus, they're spreading the virus, but they don't have any symptoms that they can detect. And then other people just have mild symptoms. They feel they have a cold, they have a mild cough, they feel a little run down or fatigued, but they don't have any major symptoms that are causing them to need more medical attention. That means, though, that 20% do have serious illness that needs medical attention. And about 15% total are severe enough that they need to be in the hospital. They need things like oxygen or fluids or nursing care. They can't take care of themselves, they're so sick. And up to 5%, it looks like right now, based on the information we have, are critical, meaning they need to be in an ICU setting. So they need more intense nursing and often need a ventilator. Not everybody in the ICU needs a ventilator, but many of those people do. And I'm sure it's come to you as it has to me, all the news about the ventilators and the focus on the ventilators. While it doesn't seem like a lot of people who get sick with this illness need critical care or a ventilator compared to the total number who get sick, it's still enough people that we as a healthcare system across the country do not have enough ventilators. So there's sort of a disconnect there that so many people get a serious form of this illness that they need a lot of ventilators all at once to see them through it. But really overall, in terms of the big picture of how many get critically ill with this illness, it's not that many. So sometimes that can seem like a disconnect, but again, it's really because of how many people get sick at the same time. The other thing we know is that many people who do have symptoms and are sick have them for about 2 weeks. And that's quite long. Many of us who've had the flu or a cold, we might feel sick total for 2 weeks, but we don't feel really sick that whole time. But really, people have been getting sick for really a full 2 weeks with fevers, things like that, the cough, shortness of breath. And many people, for example, who end up in critical care are there for about 2 weeks. And again, just to highlight that something we're learning more and more about every day is how many people actually have this virus and are spreading it, but don't even know they're sick because they have no symptoms or such mild symptoms. We're really learning more and more about that because understandably, those people haven't gotten tested as often as the people who do have symptoms. Next slide. So again, the data is evolving. We're learning more and more every day. But in this graph, we see a little bit of information for who's most at risk from dying and getting serious illness. So the graph on the right, all the bars on the left are information that we got from Italy's cases, and all the information on the bars in the right are from China. So for each grouping, it's the age group, and in each pair, the one on the left is the data from Italy and the one on the right is the data from China. So the stuff you see in red is really about older adults. And the reason that's highlighted is because one thing that was pretty clear with this illness is that older adults seem to get sicker and die more often if they get the virus. The other thing is that people we know who have some history of a heart condition or heart disease, diabetes, or a lung condition like asthma or what's called COPD, chronic obstructive pulmonary disease, things like that, do tend to have more serious illness, meaning they're more likely to need a hospital or an ICU if they get sick. And unfortunately, we're seeing that older people are dying more often than younger people. And so the graph just shows that it's roughly 3% of people 60 to 69 who have died in Italy and China if they've gotten sick. About 8 to 9.5% of people who are 70 to 79. And then somewhere in the 15% to 17% range of people in their 80s and older who died when they got sick in China or Italy. Again, this may look very different in 6 months when we have a lot more information. And in different places in the world, there were different resources. So we know that we have different resources here in the US than they had in China and even in Italy. So we will learn more, but right now, of course, this is the cause for all of the concern around how seriously older adults might be affected if they get sick. Next slide, please. I'm gonna leave it to you, Ria.
Hi, hello everyone, and thank you, Anna. As a nurse and as a caregiver and as an individual who's going through this very difficult time, it's so important that we understand how the virus is spreading. And the reason for that is the more we understand how we are exposed to it or the routes for exposure, then we also can better prepare ourselves in terms of preventing the spread. Part of what we used to hear from hospitals, and when we have family members who goes to the hospital, we always hear the universal precaution. What's happening now, over years ago, universal precaution was, it's mainly used in the hospital of using personal protective equipment, treating everything as if it's potentially infectious. It is something that we are using more and more in the community. It has now become a standard precaution because it is something that we need to do 7 days a week, 24 hours a day. It is a standard. You don't have to be a healthcare professional to do it. It's done in our school system, in our home. And standard precaution means that we are, for instance, covering our cough. When someone sneezes, we cover our cough, our sneeze, and we avoid exposure to those saliva, mucus, or sprays. In this particular virus, we added additional transmissible-based precaution to reduce the transmission in the community or the spread in the community. So on 24/7, you will do your standard precaution, making sure that you take care of yourself, you get vaccinated prior to the flu season, you wash your hands, very, very important. And what has now come to our practice is now the physical distance or the social distancing, which we will talk more further about how important that is. What we added on top of this are the droplet precautions and the contact precaution. Because the virus is spread by droplets, as someone cough or sneeze, it gets aerosolized, or the saliva is out there, or the mucus. The virus particles then come in contact in someone's eyes and nose, especially if there's a distance that's close, or someone is spraying unexpectedly by an unexpected cough or a sneeze. when that saliva gets in contact with your eyes and nose or mouth, the uninfected person then will be exposed to it. So what we're adding to this, in addition to the standard precaution, are the droplet precaution and also the contact precaution. When the saliva or the secretion that contains the virus drop on the surface or hard surface and the uninfected person touch the surface or any droplets, and they then accidentally, unknowingly touch their eyes, nose, and mouth, that is a route. That is a route for infection. So what you're seeing right now in terms of preventing the infection is there's the three modes. Our standard precaution that we're doing right now regularly, and we all been exposed to this and been practicing this, but now we're seeing the practice of wearing masks, wearing gloves, and making sure that we clean the highly touched areas. And those are all related to our actions to prevent the community spread of COVID-19. Next slide. Like I mentioned, this is not just happening in the hospital in terms of what you're hearing, the doffing of PPE. PPE used to be, it's mainly used in the hospital and all of these other terminologies. You're hearing that now because it is a public health measure that we are taking into actions to prevent the spread and preventing as many people as we can from getting it and preventing the spread of this COVID-19 in the community is so important. You've heard many times our governor, our Department of Public Health, our community leaders, our family members on the news flattening the curve. Dr. Ana Chodos will talk more about that. In terms of the public health measures, we are doing a lot in terms of the social, the personal, and environmental measures to protect the public and to protect ourselves for spreading this highly transmissible infection. And like Dr. Ana Chodos mentioned, there are some individuals who there's varying level of their symptoms and may not even know that they are spreading this infection. So in terms of the social component of measures that we can take in preventing the infection or the spread, it's really limiting our physical interaction with people, especially we made some changes in terms of quarantine, the travel bans, the social or physical distancing, limiting the gatherings, isolating the sick people, and identifying a person under investigation, close contact, and all of these other terminologies. But the main thing is in the public setting, outside, we limit the interaction that we have in the social gathering. We stay at home, we shelter in place. Then on a personal level, washing our hands, not touching our face, and using the personal protective equipment. There is a new mandate now, and that is using masks. It doesn't have to be a surgical type of mask or N95 in public, but any mask that we can use. And we'll talk more about that so that we can also take personal measures in limiting the spread of this virus. Environmental is such an important factor. Creating physical barrier between people, disinfecting surfaces. There's so many products out there that saying, oh, this, Lysol in terms of coronavirus and all of these things. And I remember someone saying, oh, they identified coronavirus, but like Dr. Ana Chodos mentioned, this is something that's been coronavirus is a group of virus out there, and it's been out there for many years. And environmental is such an important factor that we can do at home and also in our community. Next slide. Anna, would you like to describe
Yeah, of course.
this?
So just trying to take a minute to explain the physical distancing thing. So, you know, as I'm sure many of you have experienced, people you don't know or who really, frankly, are just not in your household and you're not around all the time already, we should be trying to distance about 6 feet, you know, to the best that we can estimate that. And I know we're all experiencing that at the grocery store or anywhere else we're going. You know, they're trying to enforce this. People are trying to stay away from each other on the streets. Obviously, very unusual behavior from the way we used to be, you know, not a few weeks ago even. But the idea is that droplets coming from people's mouths and nose when they talk, really when they sneeze and cough especially, but even when they talk and things like that, they actually go really far. So there's actually evidence that droplets go about 6 feet. So if you can stay 6 feet away from most other people, you'll have much less contact with their droplets. So that's just the reasoning behind that. And I think we all mostly get it, but I sort of think of people now as having sort of a cloud of droplets around them. And I'm trying to avoid not just the person, but that cloud. Next slide, please.
So thank you, Anna. In terms of some guidance that we are providing for anyone, caregivers, family members, clients, anyone, here in San Francisco, and we're hearing it statewide as well, is staying home except for essential needs. And essential needs means grocery, getting your medication, but not doing groceries every day, you know? Staying home to make sure that you need to do the essential activities that you need to carry out, including getting necessary health care. And for the most part, a lot of our medical providers are now conducting the health care visit if it's routine over telehealth, you know, so that you are not then going to clinics or hospital or in a setting where you will be exposed to a number of people. Another important thing is not having guests over during this time period. It's such a big change as well, especially for some of our clients who really need to have guests and individuals to visit them. But again, limiting the number of people who are coming in contact with is so crucial. If you need to go out, like what you're hearing on the news and what Anna just mentioned, stay at least 6 feet apart from another person. And right now we are encouraging the public to wear a face covering. It could be a bandana, it could be a cloth mask, but the important thing is staying at least 6 feet apart from other people, avoiding crowds. That is so important. One of the thing that, you know, I remember going out for my regular walk and, you know, I would walk and my son will be with me and I still kept my 6 feet, but really then I reminded, okay, we can get closer a little bit. We don't have to be occupying the entire street, but you do not really need to stay 6 feet far apart from people that you live with in your household. You may go walk, bike, or go for a run near your home. But please, if you need to take a car or take public transportation to go for a walk or run, that is going too far. Next slide. I have mentioned some of this earlier, avoiding groups, covering your face with bandana, scarf, or cloth. Keep 6 feet between you and everyone else at all times. And for the most part, if you are not going to be able to guarantee that you will be, someone will not keep that 6 feet distance, be prepared. Have a cloth, a bandana, or a face cloth mask ready so that you can cover your mouth, and you can use it to protect yourself. Reducing the time you are around other people and outside the home is very key and essential. And minimize your exposure and your contact with people outside your household. So basically, other than your close family members, if you need to go out, limit that. For the most part, many of the businesses are doing telecommuting and doing mobile work. And that is part of us doing our best to shelter in place and to create that physical distance. We talked about the contact precaution, and this is when you are very much aware of the surfaces, the high touch areas, and using antibacterial wipes. I will be sharing some guidelines that CDC have put out there in terms of what chemicals or agents are used or recommended in terms of cleaning your environment or your household items or high touch areas. And there are some guidelines from CDC, and we will be sharing that with you so you can at least know what are the brands out there. It's a chemical name, and then they give example of the brand name, and also there's some that give you guidance on the proper dilution, and we will share that with you. And another thing, which is we've been telling people this, especially caregivers, healthcare professional, if you have symptoms of cold or flu, you have runny nose, and it's unfortunate because right now it's hot and cold. It's, it's also allergy season. It is important that you stay home. If you're not feeling well, stay home, and also wear face mask when you are around people. Next slide. Anna?
Yeah.
Maybe
So a lot has been, thank you so much, Ria, for going over all this. And I think a big question that I get a lot, and things that certainly have been evolving in terms of guidance from public health professionals and our government and things like that, is the masks issue. So what masks should we be wearing? In the medical setting, there's two kinds of masks. The one on the left is more of a paper mask. It's multiple layers, and it's a little bit moisture resistant, but not very moisture resistant. And that's just a basic face mask. They usually call it a surgical face mask. And it's actually meant for people who are going into the room of a vulnerable person to not get that person sick. So when surgeons are doing surgery, they wear it so that when they're looking over what they're operating on, they don't get any of their droplets on the person. And similarly, if I go into a room with somebody who's just had a cancer treatment and their immune system might be low, I'll wear a mask so I don't give them anything that might be more dangerous to them because they're immunocompromised. But in general, what the face mask on the left, the paper one, does is just hold in that person's droplets. So if you think about that 6 feet sort of cloud around them that I was saying, I usually think of people as having that 6 foot cloud around them of their droplets. What that does is it keeps it much, much closer. It prevents them from spreading their droplets. And you can basically replicate that with a cloth mask or a face mask that is more something you could buy online or make yourself, which is some of the guidance that's been given. And I'll go over that again in a second. So that just keeps stuff in, it keeps it closer to the person. The one on the right is called a respirator or an N95 respirator. Those are really kind of special medical equipment. They're just big filters. So they fit tightly on your face. In fact, to have it work properly, you need to have been tested by a professional for a certain type of mask and know what size and what type of mask that you need to have a good fit. So it seals around the face, and then it has a really thick and sort of technical filter on the front, and it prevents anything from getting in. So in a typical time, I would wear that if I was going into the room of somebody who has tuberculosis, for example, because tuberculosis floats in the air and it's very tiny and it would get through the mask, a regular face mask, but it can't get through a respirator. And it's called an N95 because it filters about 95% of really small particles. Most people do not need that level of a filter on their face at all times. And in fact, right now in the hospital, in the clinics, we are not wearing those. We only wear those if we're working with a patient who has COVID and we're getting really close. So we're getting in their face, or we're doing a procedure, or they're coughing all over us while we're doing the procedure. And when you're that close, the particles can get airborne. They can get smaller than the wet droplets that we were talking about before. So when somebody's intubated, when they put the breathing tube in their throat, or if they need to suction or give a certain type of oxygen treatment, those virus particles can get airborne, and then you really should be wearing the N95 to protect yourself from getting it. So the one on the left really protects you from getting your droplets out into the world, and the one on the right, the respirator, prevents anything from getting into your nose and mouth, because it's just basically a really big fancy filter on your face.
Anna,
Next slide, please.
Anna,
Oh yeah.
I would like to add, with the face mask, like Anna mentioned, that it is keeping the droplets inside. Part of the public health guidelines and measure that you can take is once you put on the face or cloth mask, avoid touching the portion where it's wet or in the mouth area. So once you touch that, it is now contaminated, and whatever you touch will also be spreading the potential infectious material. So avoiding the area where the mouth is, making sure you take it off properly, using the ear loop, the elastic band, and throwing that away. And with the N95, it is something that also we are in very short supply, like you're hearing on the news, and there are now some guidelines on how the use of N95 is prolonged. Next slide.
I can explain this one. I think what Ria was just explaining really well, that the mask is a general face mask, and the ones that they're recommending we wear outdoors now are so that we're really limiting the spread of droplet particles as we walk around when we have to go outside occasionally. And the goal is that it should really cover your nose and your mouth. It should fit pretty snug over your nose, because otherwise it just sort of, as I'm sure you can feel when you've had to wear these, the air and the droplet sort of comes out the top. But to the extent that it's just really covering your face, your nose and your mouth on your face, it's somewhat helpful to keep the droplets in. And then what it's just showing on the right is, making sure it's covering the bridge of your nose. And we want to, after we're done using it, take it off. Usually you take it off from one of the sides. So whatever that ear loop is, as Ria was mentioning, just take one ear loop and sort of pull it off your face by pulling it to the side and then taking it off the other ear. And if it's a cloth one that you've made or you've bought, that's terrific. That's great. That's reusable. You can just put that into the wash and wash it with hot water and soap, and then dry it in a hot dryer as well, as much as possible. Probably the most important thing is just getting it into soapy water and washing off sort of whatever got on there while you were wearing it. Yeah, trying not to touch it too much. Obviously, the inside is more contaminated than the front part of it, but trying not to touch the actual front part of the mask, either the inside or the outside, too much. And then once you take it off and you put it in the wash, or if it's disposable, you throw in the garbage, wash your hands and wash them really well. And that should, be all you really need to then sort of be clean and safe in your house. But really the thing, as you all know, that we're trying to disrupt is people getting droplets directly on their face or getting droplets on their hands and then touching their face. So the way to interrupt that is to be covering the face a little bit, and then washing your hands before you ever touch your face. Do you want to add anything, Ria?
Nope. No, you covered it very well. Thank you, Anna.
Covered it, no pun intended. Okay, next slide, please. So that was distancing ourselves and using proper precautions. Now we're just going to talk for a second about isolating people who are sick, which is a really important part of this whole response. And in a lot of ways a really stressful part, because we know that when people get sick, they have to be isolated from other people. And that's often a time when, of course, they need people, human beings to support them, particularly ones they care about. But what's the basic idea is if someone who is sick and actively spreading the virus is not around other people, the spread will go down. So this is a very contagious virus. Everyone in the world up until a few months ago was susceptible to it, meaning none of us, none of our bodies, none of our immune systems had seen it before. And that means we are susceptible to getting sick from it. So that is why it's just spreading like crazy, because so many of us are susceptible to it. So the key thing here is if we can get sick people once we know they're sick in a place where they cannot spread it to very many people, hopefully no one. So the only people they're coming in contact with are people wearing protective equipment and no one else, then it's very unlikely they're going to spread it any further. And then hopefully that's a way you can maybe see this thing go away, right? If the last person who has the virus doesn't come into contact with anybody else who's vulnerable to it, then it would stop. Of course, that's a huge task because we have millions of people with the virus right now. But that's why isolation is such an aggressive part of this strategy to help slow the spread. Next slide, please. But it can be tricky, especially since we know that everyone who has it is not being put in an isolation facility or a hospital or something like that. So I've worked with a lot of people now who've had to isolate at home with symptoms. And the main idea is that, again, they contact as few people as possible, or as few people get into contact with their things or within 6 feet of them. I understand that can be extremely tricky, so we'll hopefully answer some questions and talk more about it. But the basic idea is that they're in a single room. Nobody else is sharing that room. The door is usually closed. Hopefully they have their own bathroom. And that if anybody's interacting with them, that they have some protective equipment. Probably the basics are gloves, a gown of some sort, or clothes that they can take off and wash, a face mask, and eye protection. So truly protecting against this virus, it can get in your eyes, your nose, your mouth. So you want to protect your eyes as well. Having the person wear a face mask is actually really helpful if they have to leave the room. So we've had a lot of folks who live in one room, but they have roommates and they share a kitchen. So if that person has to leave even briefly, that they wear a mask, because then their droplets are more contained, and less likely to spread to others. And if somebody just needs to come in to provide care, bring them a glass of water, help them get to the bathroom, as I'm sure many of you are in that role, having the person with the symptoms wear a mask while that person is around, again, to contain more of the droplets. If you do wear a mask, gloves, eye protection, anything like that, none of this is considered biohazard. It can go into the regular trash as long as somebody's not going to go through it and touch it. And the virus will die there on the material. Or if it's a reusable item, like a reusable mask or reusable gown, you can wash it. Frequently sanitizing surfaces. So again, when people have had to share a bathroom or a kitchen, which is not ideal, but is the world we live in, of course, frequently sanitizing. So using appropriate bleach solution or a disinfectant to that says like kills 99% of viruses and bacteria, that sort of thing. That's the kind of thing you want to clean all the surfaces that someone might use or touch. So doorknobs, light switches, tabletops, chairs, utensils, things like that. And just briefly, we have, I know you'll all have access to this presentation, but here in San Francisco, we have the Communicable Disease Control Branch, and they have a ton of information about what you can do if you're caring for somebody or living with somebody who has symptoms and how to sanitize and isolate. Next slide, please. Rita, you want to talk about this?
In terms of the disinfection, it's really making sure that the high touch surfaces, it's cleaned and disinfected to make sure that droplets from someone who is sick is no longer there and you're removing it. The cleaning and disinfecting chemicals, there are a number of supplies out there, and the main thing that you should be using is really soap and water. Washing your hands with soap and water is the very important, the key standard precaution that you should be practicing. And in terms of disinfecting the surfaces, make sure that you are also washing your hands, putting on gloves, so to avoid contact with the virus, but also to protect your skin from the chemicals. You're probably experiencing this now, that as you wash your hands very often, that you are now having dry hands and beginning to experience dry and cracked skin or hands. And make sure you also moisturize. That's also important, because one barrier to people washing hands and continuing with the disinfection of surfaces is because their hands are now cracked and painful. So make sure that you wear gloves when you're using the chemical agents, and there are a number of EPA approved chemical agents that you can use in making sure that your environment, the high touch area in your home, are cleaned properly. Next slide. We talked about this, and just to really highlight the phone. People wear gloves thinking they protected themselves from the contact and practicing contact precaution, and then the phone rings and they grab the phone with their gloved hands. So remember, take off the gloves. That's also contaminated or dirty, considered contaminated or dirty. So phone is very important. Clean your phones often. The rest, table, countertops, that is something very important. A lot of the grocery stores are also helping and also practicing contact precaution, as well as social or physical distancing, but they're now also cleaning handles or grocery carts before they give that to you. And those are also important factors to consider, so we can all prevent the spread of this infection. Next slide. Anna?
Yes.
Yes.
You know, this is just, I just want to take a minute and say, you know, obviously a big question that's increasing in how often we're getting asked is, you know, what can we reasonably expect for the future? I think people are understandably stir crazy at this point. The reality is it's uncertain. Obviously, every day we see different predictions about where we are in the surge, or, in terms of, are we starting to control this or not? I think certainly we've had some evidence in San Francisco County that our curve is not as sharp as it has been in some other places, meaning we probably have made headway by all of our physical distancing and stay-at-home orders. So every day that works, every day that we slow the spread actually changes the future. So our future is dependent on the present, which perhaps is somewhat obvious, but I think we are in the process of actively seeing the impact of what we're doing and the changes that we've made to how we're interacting in society. So we will learn a lot. These stay-at-home orders that are in place at least until May 3rd will certainly mean that we know a lot more about what is left to contain, how much virus is there in the community. And of course, every day we're getting more accessible, faster testing, things like that. So the future is not written is the good part, but the difficult part is not really knowing exactly what lies ahead. So there's just simply, when will restrictions ease up? I don't know that we know. But every day that we do a better job of controlling this virus means that we are closer. The only thing that is challenging is not knowing how our fate is tied with others. So if we do a really good job and we have fewer infected people, it means there's less spread every day and that containing it is easier. And then once we loosen up restrictions and people go back to interacting again, we're going to see little outbreaks, but they'll be easier to contain. And of course, we'll have more experience quickly containing them, getting tests out, things like that. I think we can imagine that will be the focus in the future once things sort of start to open up again. But what we don't know is how neighboring counties, neighboring states will be doing. And if they have a ton of virus, obviously it'll be a ton of sick people, it'll be a lot easier for them to come in and start new outbreaks here. So our fate is also somewhat tied to other counties and other states. But I think we do know that it will be a while longer before things really loosen up, hopefully when this stay-at-home order ends, but not likely. And we will have to see how others do as well and how they're able to contain it. And the other really somewhat optimistic thing I would say is that we certainly are seeing an explosion of studies in medications, things that might help make dealing with the illness easier, ways to treat it that blunt how severe people get in terms of, the thing that's really killing people, which are the pneumonias that people are getting, the lung complications. So I think there is uncertainty, but there's also within that uncertainty hope. And unfortunately, it makes planning really hard, especially, for all aspects of life. But the more we know on a day-to-day basis, the more we'll know about the future. And I think these next few weeks are really going to help us know when we will see an end to this. I will say, though, right now we are seeing more and more cases in pretty much all California counties. There's no county where the cases are decreasing on a daily basis. So we're still on the upward part of our curve, even if that curve is flatter.
Thank you so much, Dr. Anna and Nurse Ria. Truly, FCA is true to its words, committed to quality in providing the best of what's available through timely, prompt service, well-trained staff, and up-to-date information. With this webinar about battling against COVID-19, we, the community, will be able to protect and defend ourselves from the pandemic, together with the help from each other. And now, we have come to the awarding of certificates. Allow me first to read the content of the certificate. Project Pro-CARI, Civic Welfare Training Service, Legazpi City. Certificate of Participation. This is to certify that has attended the webinar series of Project Pro-CARI, providing clear and reliable information about healthcare in this time of the pandemic. Given this 24th of April 2021 via YouTube premiere. Signed, Renjan Dolzarmenta, Project Head of Project Pro-CARI. Note, to get a copy of the Certificate of Participation, please do message Project Pro-CARI's official Facebook page. Yes! We are now at the end of Project Pro-CARI webinar series. Project Pro-CARI deeply expresses gratitude for the support from day one up until today. We hope that Project Pro-CARI's objectives were successfully achieved, which is to provide clear and reliable information about healthcare in this time of a pandemic. Thank you so much.